I'm Karen Frost. I'm the CEO and co-founder of MIMOSA Diagnostics. I'm also a plastic surgeon and a PhD scientist. And for 25 years, I've been putting the clinical and the science together, investigating and building technology to assess the skin to determine who will heal or who will not, or what are those next steps in the therapeutic pathway. MIMOSA is different than other technologies on the market because we use diagnostic imaging as the foundation. So it's considered to be a vascular assessment of that tissue. And what I wanted to explain today is why we use diagnostic imaging as that foundation. If we look at the current state of affairs, and we've digitized wound measurement, we've been able to take, great photography of the wounds, but it still doesn't tell us that full healing potential of the tissue. And we'll use the car again as an analogy, and I've used this analogy before. The first is when we look at this car, we can tell the car is gray, we can tell its height and its width and its length, but it does not tell us, does that car have enough gas in the tank to get off the lot? Is it drivable, or what's wrong with it? By looking below the surface of the skin, which is what imaging modalities do, we can see, does a car have gas, a wheel? Is it battery driven, or are we into a catalytic converter? We can look and see where's the problem and how do we address that. So it's directing us to finding the solution at earlier time points versus that wait and see approach. So again, I'm not saying that wound measurement or photography aren't important. They're absolutely critical in the things that we do every day, but it is a wait and see approach. We're waiting to see if the wound's healing. We're waiting to see if our treatment's effective. Imaging modalities can tell us in real time if that treatment is working or not. And we do need integrated functional solutions if we want comprehensive wound documentation. Let's just talk through a different area of medicine, because frankly, wound care is one of the few specialties of medicine that does not have a diagnostic aid in some capacity. So let's talk about oncology. So in oncology, diagnostic imaging has absolutely revolutionized how we treat these patients. In fact, it's led to reductions in mortality, catching people at earlier stages in disease, and better risk profiling and staging of the patients. You cannot perform effective treatment unless you have an effective risk profile and an effective stage. How can we treat people when we don't really understand where they fit within that profile? And let's talk through one example in oncology, and that would be mammography. So mammography was introduced in the 1970s. And over the next 15 years, it finally became the standard for screening and catching breast cancer patients at earlier time points. It led to reduction in mortality, or that breast cancer mortality rate decreasing by 41%. We could catch people at earlier time points in an earlier stage of disease. It was better for staging the patient. It was better at surveillance, and the therapy was effective. But again, we got the right patient to the right treatment at the right time. We can do the same thing in wound care, but it is necessary for us to have an imaging modality so we can follow the progress and changes that our therapies are making in real time. Why we use diagnostic imaging as the foundation is really looking at charting data. When we mine a chart, that chart, and again, for people who don't know a lot about artificial intelligence or machine learning, or even how we would do some of this health informatics, a chart data can be very unstructured. So my note, that I might create in my clinic might be very different than the note that my colleague creates the next day. It might be different than the nurse on the Wednesday. It can be sparse and fragmented, even though we template the notes. In a lot of cases, it still doesn't have all the details we need to really mine that data properly. It is subject to interpretation. It is my interpretation of what happened. I'll have some objective data within that chart, but it can be extremely subjective. And not only that, again, as I mentioned before, that low reproducibility. Also, again, and I'll explain this once we go through the diagnostic imaging side, there can be limited explainability. Meaning that if it pops up and it tells the nurse or myself, like the next step in the therapy is, you need to order an offloading surface. Well, why do I need to offload, or why do I need to order that surface? It doesn't really explain to the person on the front line why they're doing what they're doing. And this is really important. Change management comes when people understand why they do what they do. These are smart people on the front line. and having a computer pop it up. There's a lack of trust for that prompt. By using imaging data, it's highly structured. So pixel by pixel, it is not subject to interpretation, or there's minimal interpretation. There are millions of data points that enable us to learn faster than any other insight on the market right now. And they're standardized. It is the same image that's being captured over time. This is a true competitive advantage for us at MIMOSA by being able to capture that image over time. It's a pixel by pixel analysis. Not only that, when you show an image to someone, and people say a picture is worth 1,000 words, you show that image and say, for example, red is good, blue is bad. Very simplistically, they understand that why I'm ordering, for example, that offloading surface is because we need to improve the blue zones. By improving the blue zones, this patient is less likely to break down. And again, that's a very simplistic way, but people understand why they are doing what they're doing. Then you give the same thing to a patient and they understand why they need to be compliant with offloading, why they need to wear that offloading boot. It really helps us understand, again, why we're doing what we're doing. And that's all part of change management and a really big advantage to diagnostic imaging as the foundation. Let's give some examples in peripheral artery disease. Again, fully referenced, and we're happy to provide those references. But we look at charted data, so what we've had classically are the current status quo versus functional imaging and screening sensitivity for PED. Again, with EMR data and a clinical assessment, it has a screening sensitivity of 7%. So again, not a very good screening tool. With ABI, a non-invasive test that many of us use in our practices, it's about 57%. So it's a little bit higher than flipping a coin, and it can be lower when we look to diabetes and chronic kidney disease. But duplex ultrasound, which is functional imaging, I'll just use that word again, has a 96% actually screening sensitivity. Now, who is getting a screening duplex ultrasound at the bedside? It's not going to happen. It's too expensive and it requires a trained technician. However, what we need to do then is have something for that vascular assessment that's one step before. And this is where MIMOSA comes in. We can provide the imaging solution that helps screen people better. Again, knowing who needs to go to that definitive test. And this is what's really important about imaging data. And then I'll just leave you with this. Right now, we are treating people once they're eroding through their skin. So we have a wound, we need to know what are those next best steps in therapy, of which we still use mainly a visual assessment. Being able to use a tool that can look below the surface of the skin, can tell you what are those next steps in treatment, can help you make better decisions at point of care, and evaluate your treatment efficacy over the duration of that healing journey is absolutely necessary to this sector. In fact, it happens in every other area of medicine except this one. It allows us to standardize the treatment pathways and to start to come up with, standardized ways of healing people. Not only that, once a patient is in remission and is healed that wound, we can monitor and make sure that there's not a recurrence. This also happens in oncology. We can do the same things as oncology. Most importantly, we need to understand how we get to people before they end up with a wound. If we can also understand intact skin, we can understand why people break down. And that capability with imaging is possible on that entire tissue health continuum. This is why diagnostic imaging in wound care, it is a new thing, but it is the thing that is going to change this entire sector. And it'll change that entire sector for the better. And we start to look more like the other areas of medicine. We become the specialty. It shows the complexity of the things that we do and elevates the entire sector. And it provides the people who are paying for these treatments the evidence they need to say, yes, this advanced therapy is necessary. You have the proof and the data to show that that's the case. Again, I've spent over half my lifetime building these technologies. We know how to do this. This is the next step. It is the future and the catalyst for innovation in this sector. Certainly happy to discuss, reach out for questions. We just want to help. We want to save limbs and save lives, and we do that through the technology and enabling our clinicians to make better decisions.